Are you struggling with infertility? Have you been told that you have a poor ovarian reserve and very less number of eggs are remaining in your ovaries? Hello, my name is Dr. Sakshi Bansal, MBBS MS DNB Obs and Gynae with fellowship in IVF and infertility. In my past experience of 15 years, we have helped many patients conceive through IUI, IVF and through natural methods. In this video, I will be dealing about poor ovarian reserve and its effect on infertility. So, first we have to understand what is ovarian reserve. When a girl is born, she is born with a fixed number of eggs in her body, which are approximately 1 to 2 million. As she reaches puberty and starts her menses, then this reserve goes down and she is left with 3 to 4 lakh eggs in her body. And after that, every month, a cohort of follicles is selected, out of which only one egg matures to ovulate, and which gives her one chance of conceiving. But in this process, approximately 1000 eggs die every month, and hence the number of follicles goes down with each passing time. So what happens is that your ovarian, at a particular point of time, the number of eggs that remain in your body is called as the ovarian reserve, and it keeps on decreasing with age. So how do you determine the ovarian reserve? How does the doctor tell you that what is your ovarian reserve? It is done by two methods. First is transvaginal ultrasound, or TVS. The doctor does this on the second day of your menses and counts the number of small follicles that are there in both your ovaries, which is called as antral follicle count. The second method to determine is a blood test, which is called as AMH, that is anti-Mullerian hormone. So both these tests, that is AFC, antral follicle count, and AMH, determines your ovarian reserve. So what are the factors that influence the ovarian reserve? Number one, most important, is the age. Age is the most important determinant factor of ovarian reserve. As the age increases, the ovarian reserve decreases, and this decrease is permanent. It decreases rapidly after the age of 30 and very rapidly after the age of 35. So in Indian population in general has a low ovarian reserve as compared to others. It also depends on person to person and the genetics of the individual. When you take multiple treatments for infertility, especially ovulation induction, then also the ovarian reserve decreases very rapidly. And there are other factors also, like cancer, endometriosis, then radiotherapy, chemotherapy, etc., which decreases the ovarian reserve very rapidly. So how does this ovarian reserve affect your fertility? Once the ovarian reserve goes down, the quality and the number of eggs both decrease, and they have a detrimental effect on the fertility, and it becomes difficult to conceive when the ovarian reserve goes down. It also decreases the chances of pregnancy, the chances of live birth, and increases the chances of chromosomally abnormal babies and hence abortions. And these patients also tend to attain menopause at an earlier age. So what are the treatment options for the patients with poor ovarian reserve? If your ovarian reserve is low, then you should plan pregnancy as soon as possible. You should opt for advanced methods for conceiving, like IUI and IVF earlier, so that you conceive earlier and you have a better chance of conceiving. Also, if you are planning to conceive at a later date, then you can opt for freezing your eggs or your embryos at a particular point of time. There are some medicines also which helps in improving the quality of eggs, but generally there is no such medicine which can increase your ovarian reserve, as this decrease is always permanent. Now, in extreme cases, when the ovarian reserve is very low, then the doctor may advise you to opt for donor egg IVF cycle if you have failed all other treatment options and the ovarian reserve is very low. Hope this video was helpful. Thank you.